We as dental professionals are trained to treat dental problems, but we're also trained to help prevent dental problems. The reality of a lot of people is that they only went to the dentist when it hurt, and that was to have the tooth extracted or the tooth filled. Here at Expressions Dental, we spend a lot of time looking at causes of problems, so we can help advise our patients what they might reasonably expect to have happen in the future. Now, one of the most frustrating responses that we hear once we've done a comprehensive examination, diagnosis, treatment plan, and treatment plan presentation is statements such as, "But doc, it doesn't hurt. I don't think I really need to do anything right now, do I?" My favorite is, "How long do I have before it hurts?" And then there's, "Well, can't you just patch it so it won't hurt?" The reality of it is that eventually everybody's going to get their way if they want it to hurt. We have a picture here of somebody who got their way. In this particular case, they were told that they had a sensitive tooth, but it wasn't bad enough that they wished to proceed with treatment. As a result, the tooth completely fractured and the tooth had to be extracted. We have another patient who put off having a tooth treated endodontically, and they ended up with a severe facial abscess. And finally, we have a patient who the gums bled a little bit when they brushed in the morning, but they didn't want to do anything about it, and now they have severe gum disease with severe bone loss and are at very high risk of losing their teeth. So, the ultimate frustration is when these people who have waited until it hurts come back in and then complain about the cost involved in restoring the situation at that particular point. If they would have taken care of it early on, it wouldn't have been nearly as expensive. So we have some realities here. Number one, it will get worse. It will not get better with time, it will get worse. And it will eventually hurt. In fact, it could become life-threatening. Also, it will not get any less expensive to treat. The least expensive time to treat a case is as early as possible. And Murphy's Law is usually in effect. It will start to hurt at the worst possible time. When you're heading out for your dream vacation, when you're getting married the next day, when you have a family reunion, or when you're going to be flying in an aircraft at 35,000 feet and the pressure's difference, you get to find out what pain is all about. So, as I said earlier, the financial implications are it will be more expensive to treat into the future. Years ago, there was an ad on TV about automobiles. You can pay me now or you can pay me later. The later was if they ignored problems with the little sound that was coming from their engine, and all of a sudden it became a big sound. The same applies to everything. Dental care is no different. So patients need to take responsibility for their oral health. Don't just wait until it hurts. It's a matter of priorities. What are yours?